When brushing your teeth, what should you use, my friends? Toothpaste. Everybody knows toothpaste. Well, according to Dr. Mark Hyman, maybe we need toothpaste, right? But that's not what we're saying here, and I'm not a dentist, okay? But I do want to tell you some fun facts about toothpaste, about the ingredients. We had a question the other day, what type of toothpaste should I use? Should I put this in it? Should I make my own? Should I get one with fluoride? Should I do this? I think it was a great question. And again, I'm not a dentist, but I will give you some facts that will help you to make a good choice when it comes to oral health, right? And we want to brush twice a day and we want to floss once a day, okay? American Dental Association recommendations. They also recommend that you use a toothpaste with the ADA seal that contains fluoride. Now, fluoride for promoting remineralization or keeping the bones nice and strong and supporting, our enamel and also helping to prevent dental caries or cavities, right? Now, the previous research had shown that fluoride does that. You can't knock it in that regard. You can't say that it definitely doesn't. But more recent research, a lot has changed over the past few decades, and recent research shows the fluoride might not actually even help to reduce your risk of cavities and protect your teeth to a significant degree. So that's kind of up in the air. You can't definitively really say that one previous research shows that. You gotta look at who funded all this stuff. I'm guaranteeing you Google it right now and you say, let's see if Dr. Shane's full of shit. What toothpaste is good? Fluoride. It's gonna say that. And other things are going to say, fluoride. But when you dive deep and you look at a lot of the research, you realize that there may be better options than fluoride. Something like hydroxyapatite, which is pretty much a mineral composition of calcium and phosphorus. It's something that is in our teeth, is in our bones naturally. You can get hydroxyapatite powder, right? And we'll talk about making your own toothpaste here in a second, which I'm about to do, an experiment. But in terms of fluoride, right? So aside from, maybe preventing cavities or maybe not, what's an issue with it? Well, if you swallow it, that's a problem, all right? And you brush your teeth every day, hopefully, twice a day, and you're brushing your teeth, and, if you're swallowing little bits daily, that really adds up, and you can get what's called fluorosis. And fluorosis is just a fancy way of saying a lot of fluoride got into your system and your circulation, into your body, and you can get oral fluorosis, where you have these white patches. If you've ever seen someone that has these white patches on their teeth or these yellow patches or some pitting in there, little divots, that could be fluorosis, excessive fluoride accumulation. You can also get skeletal fluorosis, and skeletal fluorosis is what it sounds like. It affects the skeleton, right? So you get skeletal abnormalities, bone abnormalities, you get bone pain, stiffness, muscle weakness, range of motion issues, all things like that, right? So we obviously like to avoid that. So what is the long and short of it? Should I get something with fluoride? Should I not? Personally, I wouldn't use a toothpaste with fluoride. The other thing is, I would instead make my own toothpaste, okay? Which contains, at least this is what I'm gonna try, hydroxyapatite powder I'm gonna get, baking soda, want to regulate the pH in the mouth, nice and alkaline, right? More basic, that's a good thing. Support the oral microbiome with extra virgin olive oil, with kefir. Kefir has a lot of probiotics. You swish it around, a tablespoon or two should do the trick. And you mix this all up, and the equivalent of, what's in your mouth, it could, reach that. Just needs to be a little bit. And cacao nibs, right? Safe, not too abrasive. But these things also have antioxidants. The EVOO can emulate oil pulling, help to kill harmful bacteria. It's got a lot of powerful antioxidants. This stuff is great for your oral microbiome, for the bacteria that are in your mouth. Should help to, help kill bad bacteria, reduce bad breath. Should help to fortify your teeth to a pretty significant degree, and you don't run the risk of fluorosis. So that's the type of toothpaste that I'm personally going to try to whip up myself. And, maybe I'll let you guys know how it goes, right? Dr. Shane's teeth are falling out. No, I think it will be fine, right? And Dr. Mark Hyman condones all of the aforementioned ingredients, and he's very well respected, right? So when it comes to fluoride, too, you have to realize, especially in the youth, right? I mean, these kids, what about kids? I mean, they swallow everything. So if you're giving them fluoride toothpaste, and especially avoid some that has dyes. Toothpaste doesn't need to be a certain color, right? It's crazy that they make it colorful like that. Put FDC 40 or whatever, of course there's a fire truck going right here. But So you want to avoid dyes, you want to avoid fluoride, especially in the kids if they're going to be swallowing it. I would at least, probably recommend, right? And even if, they're not trying to swallow it, you never know. Now, that swallow reflex, they say it develops in gestation or throughout, the time in utero, but, it's something that can't, fully develop sometimes for a little bit, up to a few months. And, giving infants having fluorosis, there are, 4 big trials that show they can cause deficits in cognition. And that's obviously a really serious thing. So I would probably avoid that. Go make your own toothpaste. That's what we got for you. But before you do anything, talk to your dentist, right? And then do your own research based on what your dentist tells you. Like, also take that with a grain of salt, right? Just like everything I tell you, take with a grain of salt. I do my due diligence, my research all the time, but I'm not perfect. When Wellness isn't perfect. I didn't learn about toothpaste, different toothpaste in chiropractic school. The hell talks about that in chiropractic school, right? But now, we learn new things every day. And from what I've learned and studied, in these past few years with When Wellness, it's a lot. But a lot of this has come from my knowledge in school and this and that. But I'm going to make my own toothpaste, You just try to get better every single day. And don't take anybody's word for anything. Look at the research yourself. And that includes, mine. I give you good information. I do my best, to give you true information that's accurate and is gonna help you guys. So, I hope you had a great day today. Who do we got on here? Thank you. What's up, Ma? I love you. You're the best. You're the best. Junior Day, peace from the east. Happy Saturday. I'm gonna go play poker. NFL, Kennedy, Steve S. What's up, baby? Gotta get you in here. Hey, I want to show you guys something. This is in my practice now. So it's up on my shelf. But look at this. My mom made me this. Isn't that beautiful? Look at that. I mean, that is so cool. The mountain here, just, the artistic ability and the love that you made this with. Lori 24. She's really great, and I really appreciate it. And it's up in When Wellness Chiropractic, up here on the shelf. So I just want to give you a little shout out, Ma. Show it to the people. Also made a white spotted pufferfish. That's really awesome. I'll show you guys that because we're here. We're doing this. This is a white spotted pufferfish. If you guys want to know what a white spotted pufferfish is, this is what it is. The white spotted pufferfish is actually super cool because it's my favorite animal. You're like, what the hell? It makes a very complicated and mathematically near perfect design in the ocean floor. If you've ever seen Planet Earth, they talk about it. And, it's really remarkable. It spends 24 hours a day, 7 days a week, full time, making this design because the current will destroy it. Look it up. White spotted pufferfish. It's just absolutely amazing. My mom made this. Look at this. This is out of string. Very artistic and cool. So thanks, Ma. I love you. And, shout out to you here. We're putting him back on the shelf. Little Fred, whatever his name is. We could call him that. But as for now, that's all we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when. But we'll see you then. Have an amazing day. Happy Saturday. Happy When Wellness. See you later.